Hello, my name is Lena Beckers. I'm a resident at Breyerkheimer Klabe Eye Surgery in Düsseldorf, and I'm honored to present you our first results with the Visiotis Progress today, a refractive segmental violet light filter IOL containing a near addition of 2 diopters. Here you can see the data sheet of this new lens, which is made from an acrylic hydrophile material. To prevent the incidence of PCO, it has a hydrophobic surface and sharp edges all around its 360 degrees. You can also order this lens in a toric variation to correct higher corneal aberrations. To give you a better overview about all current MIOL and EDOF IOL on the market, we created an overlook and listed them regarding their optical quality and focality in our review about multifocal intraocular lenses and extended depth of focus IOL in the Klinische Monatsblätter. This video shows how effortless the Visiotis Progress can be injected over a 2 mm incision under irrigation. It is easily centered. Looking at the Defocus Curve, the Visiotis shows a high spectacle independence, especially regarding the non-corrected binocular vision, what represents the real-world data. The Visiotis is here implanted in a blended vision model, so the dominant eye was aimed for ametropic vision, while the non-dominant eye was aimed for minus 1.5 diopters. In comparison to the Comfort MF15, another EDOF IOL with a 1.5 diopter near addition, the Visiotis Progress clearly shows an advanced vision in the intermediate and near distances. What is especially important to us when evaluating the use of a new IOL is of course to evaluate the patient's satisfaction. That is why we asked the patients to answer a questionnaire 3 months after surgery. We don't yet have a lot of patient data because here we show the clinical results of our first implantations. Nonetheless, we would like to show our first very promising results with the Visiotis Progress. So first, we looked at halo and glare symptoms. Our data show that glare was more bothersome than halos after the implantation of the Visiotis Progress. Next, we looked at the image quality of the Visiotis Progress. So one patient experienced blurred and hazy vision after 3 months of surgery, while no patient had problems regarding double or multiple images. The Visiotis seems to be highly tolerable for patients after 3 months of surgery and offers a very good image quality. Regarding night vision and night driving, we did not reinvent the wheel with the new Visiotis Progress. It is known that EDOF IOLs as well as MIOLs absorb light, so that good lighting is essential for best visual outcome after surgery. Another important point when looking at a new extended depth of focus lens is the spectacle independence that can be reached for the patient after surgery. With the implantation of the Visiotis Progress, a high spectacle independence was reached, especially when looking at the intermediate and near vision. Regarding far vision, some of our patients feel better to wear glasses when driving because they want to be absolutely sure to drive as safe as possible. Now, let's talk about our conclusion and the outlook we can give regarding the Visiotis Progress. The visual dynamics of the new Visiotis Progress IOL come close to the Teleon MF20. It is a real EDOF IOL that enables advanced, intermediate and near vision compared to standard monofocal IOL. It is easy to implant for the surgeon and ensures an easy centration. Clearly, an advantage of the refractive optic is that patients experience less halo and glare than with diffractive optics. And as a blended vision model, the outcome in visual acuity regarding near, intermediate, and far vision is comparable to a multifocal IOL. So even small print reading is possible for the patient. That is why the Visiotis Progress is superior in its range of vision outcome compared to the other EDOF IOL because it has advantages, especially regarding its intermediate and near visual acuity. What is especially important to our younger and modern patients, regarding that most of the modern world, work and life takes place in front of a computer screen. Thank you for your attention.